The team has identified a clear need for the device and has developed a well-thought-out plan for local production and distribution, in collaboration with several well-positioned community partners. The judges commented that the Denovo team is enthusiastic, cohesive, and clearly committed to keeping this idea moving forward. The expected impact of this device, both initially and over the long term, has the potential to be significant and truly life-saving.
Cool. Well, thank you for this award. It's quite an honor. So imagine that you or a family member of yours has diabetes and you live in Nicaragua. If you're like most other diabetic patients in that country, you do not have access to blood glucose monitoring devices called glucometers. Instead, you would have to resort to tasting urine for sweetness or take insulin continuously without knowledge of how far your disease is progressing. And this is simply unacceptable. Our team last year, we went to Nicaragua for 10 days, and there we visited the town of Esli, where we found that amongst the regional hospital and 15 surrounding local clinics, there was only one glucometer for the 800 diabetic patients in the region. Diabetes is a growing epidemic, currently affects about 250,000 people, and it is projected that in the next 15 years, 80% of these cases will be in developing countries. For effective diabetes management, a component of that is blood glucose monitoring. Diabetic patients are advised to test their glucose levels about 3 times a day. And the problem of this is that this technology is still quite expensive. Each test strip costs $1. So if you do a mental calculation, that's $1 multiplied by 3 times a day, multiplied by 365 days a year, that's over $1,000. And that's actually about the average yearly income of a person in Nicaragua. So these patients simply cannot afford technology to measure the blood glucose levels. So what we did, Denovo is we've come up with an accessible, low-cost, and robust platform that patients in these countries could use to monitor the blood glucose levels. So our solution basically consists of a novel combination of 2 technologies. First is a glucometric assay, and the second is an optical reader. So here we have developed or designed a test strip where by layering chemicals, the test strips would change in color intensity based on the concentration of glucose you place on it. And then the optical reader will read that color intensity and output the concentration of glucose in that solution. Next slide. So we have developed, for this competition, we have incorporated aspects of user testing, field testing, and also, quite importantly, local manufacturing. We have a 2-phase plan where we first plan to locally manufacture the test strips and blend the test strips with the readers. We also have established connections with individuals at MIT, Harvard, throughout Nicaragua, and Gabon and Bangladesh. And we really do look forward to working on this project in the next coming years. So thank you everyone for